Hi, everyone. My name is Emily Ersick, and I'm the Recruitment and Internships Associate here at the Congressional Hunger Center. Thank you so much for joining our final summer seminar. Today's topic will be the Zero Hunger Interns final research presentation. At the beginning of the summer, the interns were tasked with identifying a hunger issue in their college community or globally, and then they were asked to find a research solution for this issue. We have 4 presentations for you today, but before we get started, I want to introduce Shannon Maynard, the Executive Director of the Congressional Hunger Center.
Thank you, Emily. And I just want to thank Emily Ersick for all the amazing work she's done to coordinate the Zero Hunger Internship, this program, from recruiting this fabulous class of interns who we're celebrating today to the amazing cohort of partner organizations that they're placed with throughout the summer. And also want to thank Emily Umanya, and Liz Pierce, and Arthurine Walker for the work they've put into putting together a fabulous summer seminar, and I'm glad that you're joining us for this final capstone of that seminar. For those of you who don't know, the Congressional Hunger Center invests in the development of emerging leaders with the goal of ending hunger in the United States and around the world. With a focus on engaging leaders who've experienced hunger and poverty and leaders of color, we strive to bridge the gaps between field and policy, communities and Congress, theory and practice. The Zero Hunger Internship is one of the Hunger Center's 4 core programs, and it immerses college students and recent graduates in anti-hunger work in Washington, D.C. The program consists of 5 components: the summer seminars, which is a 5-part course on domestic and global hunger, advocacy, and root causes of poverty and hunger that many of you have participated in throughout the summer. Professional development days for the interns, where they come together in person to focus on their leadership skills, professional development, and explore topics like StrengthsFinder, managing up, resume writing and interviewing, public speaking, and more. Placement with policy organizations to gain on-the-job, hands-on experience in program implementation, development, fundraising, policy analysis, communications, nonprofit operations. A Hill Day, this year we launched for the first time, where interns were able to meet with their members of Congress to share more about their experiences and why they're involved with food security work. And the group research projects we're going to hear from today, where interns come together to examine hunger and potential solutions in their home communities and present today. Last summer, we conducted an independent evaluation of the Zero Hunger Intern program and learned that a majority of our graduates continue to be involved in activities connected to hunger, poverty, and policy after they complete this internship. The majority of folks felt their participation in Zero Hunger Internship influenced their decisions to continue working on these issues after college, and in many cases, it also changed their focus of their undergraduate or graduate studies. In my opinion, one of the most important findings from this evaluation was that this internship experience increased participants' professional confidence in themselves and their belief in their ability to create change. My hope is that each of you who were interns this summer leave feeling confident and proud of the work that you've done for the host organizations that you've served at, and what you've learned. And I hope you see and feel that you belong here in this policy world, right? Trying to shift and influence and build political will we need to help create a hunger-free world. You have a role to play, and you should be confident about your ability to make a difference, while continuing to be open to learning what you don't know. I have been doing this work for nearly 30 years. It's been since I was a summer intern like you. And there's still so much that I don't know, and I have to learn from those around me. And so I'm excited today to listen to your presentations and policy proposals. And I'm sure I'm going to learn something new or be challenged to think about something differently. The Zero Hunger Internship was launched in 2018 and is supported by the Sodexo Stop Hunger Foundation. A partner and supporter of the Hunger Center since 2000, the Sodexo Stop Hunger Foundation's mission is to ensure every child in the United States grows up with dependable access to enough nutritious food to enable them to lead a healthy, productive life. The foundation mobilizes experts, innovators, volunteers, and donors to feed children in the United States today and advocate for policies that ensure no child is hungry tomorrow. The Hunger Center is so grateful for Sodexo Stop Hunger Foundation's support of this program. Together, we've now graduated more than 75 individuals from the Zero Hunger Internship program, and I'm personally grateful for the partnership of the Foundation's Executive Director, Roxanne Moore. It's my pleasure to introduce Roxanne to you to share some words for this class of Zero Hunger Interns. Roxanne is a registered dietitian and has more than 30 years of experience as a practitioner in medical nutrition therapy, manager of USDA nutrition programs, and a leader in developing and implementing health and wellness programs. It was in 2019, just months before the pandemic, that Roxanne became the executive director of the Sodexo Stop Hunger Foundation. And over the past 4 years, she's led the foundation through strategic realignments. She's helped diversify and triple the number of community partnerships and grants that the foundation is able to award, and develop new initiatives that have increased volunteerism across the company and raise funds to help at-risk individuals achieve sustainable financial autonomy. So please join me in welcoming Roxanne Moore.
Good morning, everyone. It's a pleasure to be with you today. I'm going to be fully transparent and share with you guys that I had dental surgery last week. And so I'm not 100% myself. So I have some slides that I want to share with you today. But first of all, I am so honored to be with you here. Can't wait to hear your final presentations. I've been reading about your backgrounds and your experience and your passions, and I'm really excited to hear more about what you've learned this summer. Our partnership, thank you, Shannon, for that background. That eliminates me having to tell you about my background. But really, our partnership with the Congressional Hunger Center really is special. And I believe we're nearing almost 20 years, if I'm not mistaken. So I do have a few words I'd like to share with you this morning, but the most important thing is I want to make sure you know who the Sodexo Stop Hunger Foundation really is. And so let me see if I know how to advance slides. Good, I did it. So the first thing is, Shannon provided some background about our mission that's truly connected to children, but I wanted to share the image of the gentleman who was our vice president of communications at Sodexo, an employee in a corporation who I have found over the past just 3 years really was meeting with a lot of people within the community, a lot of community leaders like Robert Egger, who started DC Central Kitchens, and really leaned in and listened to what the problems were. And he said, this is terrible. This just shouldn't be happening. Nobody should be hungry. No child especially should be hungry. And so this employee back in 1996, went to our head of a global company and said, look, we need to do something. We need to start a mission. And so in 1999, it became a formal foundation. We'll be coming up on our 25th anniversary next year, which we'll be celebrating as a foundation. Unfortunately, Stephen Brady did pass away from cancer around 2011, but his legacy lives on, and it's an incredibly special legacy. And so when we look at our global strategy now, Stop Hunger started here in the US, but now it's present in about 50 of the countries where we actually do business. And I'm collaborating all the time with our headquarters in Paris. But around the globe, we do have a combined strategic mission, and that really is to respond to a lot of the food aid issues that are happening today, because again, we know that people unfortunately are still hungry. And then we have situations where there's emergency needs for food aid. But we really want to get more into the beyond food aid space, which is looking at some of those root causes of hunger and how are we addressing them? Things like workforce development and skill development, nutrition education. How are we empowering people? And then how are we truly becoming change makers and uniting people around the globe, our employees, our stakeholders, our donors, which are other companies a lot of times like Nestle, Campbell's. A lot of these organizations are supporting us and helping with fundraising. And then how do we mobilize everyone together for change in our local communities? And so we really do rely on our own employees. This is just a brief example of one program that we've implemented in partnership with Nestle Pro. with one of the segments that Sodexo manages, which is called Sodexo Live. Sodexo Lives does food service and facilities management in very large venues like stadiums. And so you see some pictures here from the Baltimore Convention Center, where we brought resources together and we make 1,500 servings of chicken noodle soup for the local community. So an idea that started from one employee, again, the big soup, has evolved into serving nearly 50,000 servings of soup across 10 different communities in just 2 years. So we're really excited to see this continue to expand. So who do we support beyond the Congressional Hunger Center? Here's just a list of a few of the organizations that we supported in this past fiscal year. And I know that some of you may have been doing some work with them this summer. I know that some of you have experience working with these organizations in your college campuses, like Swipe Out Hunger and the Food Recovery Network. And I hope that I'm happy to share these slides. I've already shared them with Emily. I hope that you'll take a moment and look into each of these organizations and the amazing work they do. It is a combination of food aid and beyond food aid work, and every one of them are absolutely outstanding. In addition to supporting these organizations, every year we also give out 5 scholarships. I'm sorry it's showing up a little weird here on this slide for some reason, but just this past year, we honored 5 youth. All of these young ladies were around seniors in high school. We had Hawaii represented, New York, Maryland, Virginia, and North Carolina. The folks that you see here on this slide, each one of them has been involved in both food aid and beyond food aid and policy change. And every year at our annual fundraiser, these are our keynote speakers. Everyone wants to hear what youth are up to. And so at the Sodexo Stop Hunger Foundation, one of the other things that we do is really focus on youth empowerment, focusing on you, focusing on the folks that you see here on this slide, because we know that they are indeed the people who are going to help us change the world going forward. And so with that, I want to kind of move on for just a moment and pause for a second and tell you just a little bit more about my journey, if you don't mind. And I can honestly share with you that, things in when it comes to, let me back up for a second and just, again, focus on telling you about myself. Sorry, I distracted for a second. But as Shannon mentioned, I am a dietitian by training, and I started my career in an inner city hospital in Baltimore. I started in a clinical environment. I've had my own private practice consulting people with diseases and eating disorders and elite athletes. I've taught in academia. I've worked for the state government and the military, administering USDA child nutrition programs. And with Sodexo, I started back with my career with them as a director of K-12 marketing for over 400 school districts. And now today, as you see, I'm leading the foundation. I'm sharing this because after looking at your bios and hearing more about your aspirations, there's a chance that years from now, you too will be telling somebody about your career journey. Today, you may even be wonder where I'm going to be 5 to 10 years from now. But I think it's important to understand that sometimes you can only look at your life journey when you look back versus forward. So, for example, I had no idea that the very first job at the Baltimore hospital or my experience with the state administering the USDA summer feeding program would have prepared me for where I am today. And so for this reason, my very first piece of advice to you today is to please be open to opportunities. Don't try to overly predict where you're going to go, because things will fall in line where they're meant to fall in line for the right reasons. And I can tell from your bios and your educational backgrounds and your interests that many of you have already had a successful and impactful path, and you have more waiting to discover. So in order to eradicate hunger, we're going to need people like you with your very diverse backgrounds and your creative minds and your passion and your commitments to be what I like to call the change makers. And it's something I talked about last year. And ironically, Shannon and team, I know I talked about this last year, and I had no connection to us adopting this terminology and the Stop Hunger is Now global strategy, but it really is an important term. And so I want to conclude by just talking to you guys for a moment about what are the characteristics of a change maker? What does it take? So in my observations and experience, my readings and my interactions with people and my own personal experiences, change makers are really people who do a good job of identifying problems and then establishing a vision for solving that problem. They don't complain. They just get things done. They understand they may not always have all the answers to a problem, and they're not afraid to network and learn from other people's experiences. Change makers generally try to leverage what has already been accomplished versus always starting from scratch. I mean, let's be clear, time moves really fast. We have a problem to solve, and so let's not waste time reinventing the wheel. Try to lean on others. And I know that I'm always leaning on the colleagues here at the Congressional Hunger Center, as well as that long list of grantees that we work with, because everyone possesses a different area of expertise. I also find that change makers tend to be courageous and curious and creative. And so for this reason, change makers tend to be really great facilitators as well, realizing that the power of collaboration to leverage others' talents and ideas and resources are really the best way sometimes to get to the right answer. And for our organization, the foundation, we often describe the foundation as a strategic collaborator who works to amplify impact with others, like we've done with our Big Soup program, because no one truly can do it alone. And finally, change makers, in my opinion, are paradigm shifters. To end hunger, we have to change people's understandings and mindsets about hunger and its root causes. I spoke to someone just the other day who I thought really did understand the root causes of hunger, and they asked me to provide additional background on it. So again, we always have to help make sure we understand where people are on their journey of learning and help them understand the issues that we're talking about. We have to understand what's motivating people to want to engage in our missions. What are their personal interests? And connect the realities of hunger to the things that they care about. So sometimes this means you have to become a really good storyteller. And for people who know me, having dental surgery has been the worst thing that could have happened to me because I love to talk. And I haven't really been able to talk much over the past 2 weeks. And I also, as part of storytelling, I want you to realize that you should never assume that people know what you're talking about, especially if you're using acronyms. My team and I recently have engaged a few people in some conversations, and we've kind of tested out. Do you know what BIPOC means? And you would be surprised at this state of the game how many people do not know what BIPOC means. And so we have a rule at Sodexo where you should never just throw out acronyms. You should always seek to understand if people understand the acronyms. And so when I am talking about hunger, the conversation can take on different forms depending upon who I am speaking to. So if I'm speaking to someone in healthcare, what they care about are healthcare costs. So I might angle the hunger story in that direction. A superintendent cares about student success. And a business partner may be motivated by climate change. And we all know that hunger is connected to all of those things. And so there's a way to spin the story in a way that we can try to get people, we can shift the paradigms that they're in today and help them become more motivated towards the missions that we care about. So I truly believe that each and every one of you are going to help influence significant positive social change in our world. And I just simply want to thank you for your passion and your commitment to the issues that are going to help to improve the quality of life for everyone. And you should feel really good knowing that you've already accomplished amazing things. So again, it's a pleasure to be here with you all today. And again, thank you, Shannon, for this opportunity.
Awesome. Thank you for that, Roxanne. And as always, for supporting the Zero Hunger Internship. Now we're going to get started with the Northeast group, focusing on college food insecurity. Also for the audience, I didn't say this earlier, but there will be a designated Q&A time after each presentation to answer questions. So please just start dropping those in the comment section when you have questions. So thank you.
Awesome. Everybody, we're here today to talk to you about college food insecurity. And the reason we chose this topic was kind of twofold. tasked with researching the Northeast, and there's sort of a particular concentration of colleges in the Northeast. And second, we also thought that as college students ourselves, we thought that we would be able to provide a special view into this and insights coming as people who are in college. So without further ado, let's meet the team. And I'm happy to start. So my name is Olivier. I'm currently working with Interaction. I'm from Harvard, Massachusetts, and I'm going to school at University of Massachusetts Amherst.
Hi, my name is Narissa. I'm currently placed with Share Strength, and I'm from Great Neck, New York, and I go to Binghamton University.
Hi, my name is Khadija Rashid. I was placed with the U.S. Department of Health and Human Services. I am from Brooklyn, New York, and currently attend Cornell University.
Hi, everyone. My name is Evan Appel. I am placed with the Food Research and Action Center. I'm originally from Philadelphia, Pennsylvania, and I go to school at the University of Delaware. So to jump into our presentation, just to expand a little bit on what Olivier was saying, to provide some background as to why we chose this topic of college food insecurity. So education, particularly higher education institutions, they've long been cited to be this great equalizer amongst socioeconomic classes and have this ability to uplift individuals in society. However, we really think that this attribution is falling short. It ignores the fact that a lot of college students are truly unable to meet their very basic needs, such as getting enough nutritious food. In recent decades, we've been fortunate to see that admissions and recruiting efforts have made large strides in reaching underserved populations and admitting increasingly diverse classes through affirmative action efforts and increased diversity initiatives. However, we really believe that greater support is needed for these students post-matriculation and post-committing to their university to continue assisting in this transition and then sustained success in the future. We also believe that this topic is very relevant to us as interns, as current college students, or recent graduates, because all of us have either personally experienced hunger in college or we've seen this as the reality for our peers and our friends. We're also very familiar with the intrinsic vulnerabilities of college students, as we are all currently investing lots of time, energy, finances, and hopefully gaining a lot in return in the future. But not being able to meet your basic needs as a college student can really only inhibit this daunting goal.
Awesome. Now that Evan has sort of talked about why college in particular, I wanted to look at the prevalence, effects, and implications of food insecurity among college students. And so first, starting with the prevalence, we see that while about 1 in 10 people across the US experience food insecurity, college students experience that at a 1 in 3 rate. So we see that it's an especially hard-hit population when it comes to experiencing hunger. And that's important because that is the manifestation of multiple overlapping systems of oppression. And so, like Evan sort of alluded to, that means that while we might be improving access to education, if we're not improving the utilization of that education and ensuring that students' basic needs are met, then that means that we're sort of exacerbating those inequities. Next, moving on to the effects, we know that being hungry really impedes your ability to make the most of your education. So students who are food insecure experience stress, depression, and anxiety at about 6 to 10 times the rates of students who have high food security, which means that they also have the inability to focus. They're exposed to additional risk of developing eating disorders or developing disordered eating patterns. And they're also just constantly worrying about where the next meal is going to come from, which obviously is another thing on your plate on top of having assignments and extracurriculars and maybe working a job to make enough to have food to eat. Finally, what are the implications of this? Well, we know that students who are food insecure are about 40% less likely to graduate from college. And they're also less likely to later achieve a postgraduate degree. And at a high level, like I alluded to, this means that we're exacerbating existing inequities if we don't, make education equitable and provide students with their basic needs. This means that students are going to have lower average GPAs, and this ultimately means that they're not going to be achieving their full potential when they finally go on to a career.
So now that we know the prevalence of it, the root causes, this is a silent crisis that affects countless students across the nation, preventing them from achieving their full potential. So firstly, we'll dive into financial limitations. Financial limitations are a crucial root cause of college hunger. Rising tuition and living costs make it challenging for students to make ends meet. Insignificant financial aid packages often intensify this problem. There's also many accessibility barriers, such as lack of awareness, which intensifies college hunger. Some students may not know about available resources like food pantries or support services such as SNAP. The stigma surrounding hunger can also prevent students from seeking help. The fear of judgment or embarrassment leads to hiding struggle, impacting students' well-being and academic performances. Physical barriers such as long distances to food centers and limited transportation options also compound the challenges for financially struggling students. There are many poor campus services in place, such as restrictive dining hours, limited on-campus food options, and inflexible meals plans can worsen the situation. Faculties and staff may also lack understanding, hindering effective assistance to struggling students. Often, colleges and universities struggle to provide adequate support for students facing food insecurity. Limited resources, administrative challenges, or a lack of awareness contribute to the problem.
So Khadija mentioned a lot of the root causes of hunger, and I wanted to get into some of the current approaches to actually addressing it. So first of all, we have College SNAP, which is great because it allows students to shop on their own, so they're able to actually choose what they're buying for themselves. And that way their personal funds can go to other necessities than food, such as housing, food, school materials, among many other things. SNAP also has been proven to stimulate personal and academic well-being. They'll be able to focus on school and put their efforts into something more important at the moment. It also is really beneficial for the economy. As we all know, $1 into SNAP is $1.50 into the economy. However, it does have very strict 20-hour work requirements, which can be very difficult for students to navigate as they are also partaking in courses. SNAP can also be very difficult to navigate without help because of the very difficult system that is in place, and students might not even know that they're eligible. There are also food restrictions as to what SNAP can actually be spent on, which does limit the efficacy of it. There are also meal donation programs at universities, so this allows students to use campus dining halls as normal, so that kind of takes away from that social stigma of having to go somewhere else for your meals. However, it does rely on other students' charity, so it's not a very consistent source for students who are struggling. There are also on-campus food pantries, which are great because they're free and they are on campus, which makes it much more easily accessible, and they're primarily geared towards students. However, they might be stocked with ingredients students can't or don't know how to use, and it is funded by the university or by donations, which again makes it unreliable. There also is a bit of a social stigma associated with using it, so some students might avoid actually taking advantage of that resource. So we recognize the shortcomings of some of these approaches and how rampant the issue is, so we do have some suggestions about how to combat it, starting with supporting already proposed policies.
So the first solution we want to support is federal adoption of the Hunger-Free Campus Act. The Hunger-Free Campus Act aims to remove one of the biggest obstacles to education, hunger. By ensuring reliable access to food for students, we can enable them to focus on their studies without the burden of an empty stomach. This proposed legislation intends to establish and expand food assistance programs on campuses, simplifying access to SNAP benefits, raising awareness, and reduce stigma surrounding food assistance. While some states have accepted the act and its advantages, the act remains up in the air in other states. Through federal expansion, universities and colleges all throughout the nation will be able to access federal funding and utilize government assistance, enabling them to create long-lasting programs and, as a result, creating a healthier and more favorable learning environment. The impact of this on students cannot be overstated. When we alleviate hunger, we help unleash the full potential of all these students.
Awesome. Now moving on to the second policy that's already been introduced. I believe it was most recently referred to the House Committee on Education and the Workforce. We think that increasing SNAP usage via HR 309 or the Opportunity to Address College Hunger Act would be another effective solution in addressing college hunger. How the bill works is that it would require institutions of higher education or IHEs to notify work-study students of their possible SNAP eligibility. And this would include the Department of Education talking to like administration at different universities and like providing them guidance on how to do this. This is important because, first of all, it's close to zero cost to implement. This would simply represent good governance on their part. And this is making use of funds that have already been set aside. So it's really just the administrative cost of, implementing this program. Also, we know that SNAP utilization is relatively low among college students. So only about 31% of SNAP eligible college students actually reported receiving it, which is leaving about $3 billion on the table that has been set aside, but is not being used for a variety of reasons. And the implications of this is that pushing for support for the policy would advance equity, boost graduation rates, and it would be investing in our future workforce.
All right, so now we wanted to use this opportunity to introduce a few new policies that we came up with. So one solution could be expanding the work requirements that are connected to receiving SNAP benefits. So currently, if you're a college student and you would like to receive SNAP benefits, you also have to work a part-time job, which is 20 hours a week, as Narissa said, in addition to your classes that you need to graduate. And if we could expand the definition of what a work requirement means to include the credit hours that students are already investing so much time in, this could be a real game changer for low-income individuals, especially for students that have already demonstrated this great financial need. So already applying to colleges and trying to receive a financial aid package, students fill out a lot of forms and then are sometimes granted Pell Grant recipients. So these students have already demonstrated that they have a great financial need, and to then add additional burdens, we think is honestly pretty cruel. Most students, if they wanted to take full advantage of their bachelor's degree, should average about 15 credits a semester, which translates to about 15 hours of time in courses, so that they can get their bachelor's degree in time. But then you add on that 20-hour work requirement in order to help feed yourself from day to day. And this is truly just an unfair burden that low-income individuals have to shoulder that more affluent peers really don't need to worry about. So if we counted these credit hours as work hours, low-income individuals and students receiving and benefiting from this change would now have much more time that they can spend doing other amazing things about college that we've all been fortunate enough to experience, things like unpaid professional experiences, joining clubs and having leadership opportunities, sports, or really just events and activities that are purely there to have fun, all of which are really important parts of the undergraduate experience. These Pell Grant recipients have already jumped through some major hoops and demonstrated great financial need. So again, we think that it's cruel that we are forcing them and having all these strings attached to SNAP benefits of working an additional 20 hours a week. And counting their course credit hours as work hours can free up a lot of time and really make feeding themselves much easier.
Thank you, Evan. So another one of our proposed policies are mandating a resource navigation assistance on campus. So this would include universities appointing somebody to direct students to local and government assistance. For example, things like SNAP, local pantries, just things in the community that they may be able to access for their basic needs. This point of contact should have a really good understanding of the assistance programs and be able to be very available for students. To do that, they should have their contact information very easily available on the university websites, as well as keeping open lines of communication with the students, which can be done by introducing themselves during orientations and actually reaching out to Pell Grants and financial aid recipients, or just students who might have demonstrated need. In doing this, it will be able to provide students a clear point of contact and allow them to easily navigate all the programs that are actually available to them. This also is really important in tackling that barrier of awareness that a lot of students might be facing, where they don't even know what they're facing is truly an issue or how to solve it. And by having this point of contact, students will be able to address their basic needs and security with guidance. Thank you guys so much for watching our presentation. We're happy to answer any questions you guys might have, and our contact information is available on the slide if you'd like to reach us.
Awesome. That was very impressive. That was very interesting. We do have a couple questions in the comment section. So the first question that I'm seeing is, can you speak more about the experience you have with fighting hunger in your own respective college communities?
Sure. I'm happy to start on this one. And I think this actually kind of gets to Livy's question as well. I work at the Amherst Survival Center, which is a community center in my college town. And I think that what they've experienced is that, not only has hunger been on the rise consistently, as opposed to like the past where maybe it would fluctuate seasonally, but we've also seen that I think the Amherst Survival Center employs a particularly innovative approach in kind of taking down the barriers that are traditionally there for food assistance. So, transportation, they recently have implemented a food delivery program, which has been huge for like our graduate students who are living farther away, or students who, for various reasons, cannot access the pantry. They've also tried to reduce social stigma by creating just a communal cafeteria, which is where everyone, volunteers, community members can all eat together. And so I think that is one thing that I've at least seen in my campus community.
And to add on to that, besides some of the meal donation programs that my university has enrolled in, where we can give our guest wipes and donate those to students in need, something else that I've worked on my college community has been developing these like home hydroponic kits. So students can basically grow leafy greens and herbs on their windowsills. And while this is in no means really changing lives or erasing hunger from our campus, the ability to have students take charge and empower them to grow their own food is something that we've been also striving to do.
Very nice. Narissa or Khadijah, do you want to hop in on that?
Yeah, I mean, personally, I've experienced working on my campus's food pantry and really seeing the people who are making that foot traffic happen and how often it really does occur among college students, which can be super surprising considering a lot of people just assume college students will go through the struggle of eating ramen every day, or a lot of college students come from affluent backgrounds. They don't actually feel this struggle, but it happens at such a high rate, and being able to work at the food pantry has just been really interesting. And actually addressing it, although it's not at the root cause, being able to help in some way is really amazing.
Yeah, just adding on to that, I think it's been amazing to really see how the food pantries I've been working on, like at Cornell too, like there will be a lot of students who do need it and will be coming, and there's a lot of discussion on SNAP that's been increasing on my college campus, and that's why I think like increasing those discussions is really important as well.
Very nice. So we have another question from Ashlyn Anderson, who was actually in my Zero Hunger internship class in 2021. So very exciting. She says, how do you recommend integrating holistic basic needs support, such as housing, into the discussion around food insecurity? And whoever wants to hop in.
So housing obviously is super important with college students. In a lot of college communities, there's a huge amount of price gouging with housing because there's this assumption that your parents will pay for it, or they will pay for it to live in a certain area, which can be really difficult for students who are demonstrating financial need. They have to put close to $1,000 a month for housing in certain areas, and that takes away from their money that can be spent on food, for school necessities. And on top of the rising tuition costs, there's just crazy high costs for students right now that are not being addressed, especially in terms of hunger. Hunger is something that requires extra income. You need to have the money to spend on food. You need to be able to buy your groceries, buy the things to use the groceries in like pots and pans, pay for your electric bills or gas bills in order to actually use them. So we do need to, work on that together. It's a very large issue. I don't know exactly how to put that all together, but again, with our final solution about that point of contact, having somebody who can address the housing insecurity that might be occurring in the community, being able to point them towards affordable housing or possibly grants that might be able to help them pay for their housing would be really great, and it wouldn't just support food insecurity, but it would address it in some way.
Any of you want to add on to that?
I guess I just wanted to add on that we like kind of agree that this is like a huge portion of like the problem when it comes to food insecurity, especially because like housing on campus and problems related to that are kind of exacerbating the already existing housing crisis in our country. So we know that like students like going to housing outside of campus like drives up the rates, like the monthly rent. And so it's raising the cost of living for community residents who are not attending college too. So we just wanted to echo that we see that as a huge issue.
It does look like that was our last time for questions, but anybody who has dropped questions in the comments and wants to, further those, you can reach out to them with the emails that they have up on that screen.
Thank you guys so much for listening to our presentation. If you guys have any questions, again, please reach out to us, even if that's about supporting the policies that we already mentioned. And I'm so happy to pass it off to the Midwest group. Thank you.
We're just waiting on a few group members to join us, and then we will be ready to present. All right, awesome. Hello, everyone. We are the Midwest group, and we are presenting on the vulnerabilities of Midwestern farming communities. To start off, my name's Livy. I am currently positioned at Halcyon for my Zero Hunger internship. I attend University of Virginia, and I am originally from Colorado. Hello, I'm Patience Lightfoot. I'm originally from Edmond, Oklahoma, and I attend Oklahoma State University, and my placement is with the Center for Law and Social Policy.
Hi everyone, my name is Ignacia Mendez. I am positioned with Bread for the World. I go to college at the College of Worcester in Ohio, but I'm originally from Chile.
Good morning, everyone. My name is Daniel Zavala. I'm originally from Mexico, but I am a student at the University of Oklahoma, and this summer I'm placed with Prosperity Now.
So our research is mainly focused in the Midwest that are like those 12 states that you can see on the screen. However, as many of us go to school in some states in the Great Plains or like were raised there, we decided to expand our research to the 15 states also that are considered the Great Plains because they're like, we like know about them and they have similar demographics.
I wanted to touch on the history of the region, which includes major contemporary influences such as Northwest Ordinance of 1787, which set in motion settlement patterns and community building as the Northwest and Midwestern Territory became states. This was further accelerated by the Homestead Act of 1862, which granted heads of families 160 acres of land, which remained in effect until 1976. This motivated the shift of public domain lands entering small family farms. Land runs and cattle drives function as a derivative of the Homestead Act, where cattle drives made it so that livestock was transitioned from the northern Midwest down to the southern Great Plains. And land runs has represented the establishing demographic shifts as indigenous tribal lands became majority white farms through staked land claims. The Dust Bowl in the 1920s and 30s was a major drought in conjunction with the Great Depression, which brought on by dryland farming and overgrazing across 19 states in the region. Poor soil conservation practices caused most farming families to go west, really contributing to population loss in the region as there was no facilitation of income. Finally, the post-World War II, the popularity of using machinery in agriculture became widely used, supported consistent farming of more specialized and profitable crops. This history demonstrates the landscape we see and study today in the Midwest Great Plains area, and it's consistent with historical influences and practices indicative of the weaknesses in agricultural-based communities. So that brings us to today. So after doing a literature scan, to the best of our knowledge, not a lot of data exists regarding food insecurity explicitly experienced in Midwestern agricultural communities. Because of this, we decided to take a social determinants approach to our research. So in other words, we will be surveying a non-exhaustive list of conditions that make our population vulnerable to hunger. And Ignacia is going to start us off by speaking on the condition of climate change.
Climate change. Of course, many of you know climate change has affected a lot of countries and different areas throughout the world. However, it has also affected the Midwest. So one of the three main causes, like the three main issues climate change has raised in the Midwest are extreme weather events such as droughts, flooding, heat events, and soil erosion caused by winds. This has created resource scarcity such as water, since many of the methods used by farmers in the Midwest are irrigation methods which use a lot of water, and they have to change to dryland methods, and this like transition from irrigation methods to dryland methods creates economic hardships. Also, there's a lot of there's an increase in risk in pests and diseases. Many researchers have found that these rises in temperatures have expanded mosquitoes around the world, and these mosquitoes carry diseases such as dengue and Zika. As you all must already know, Zika doesn't have any treatments or vaccines. The amount of crops losses have totaled over 8.8 billion US dollars. And most of the income farmers gets are from agriculture. This reducing income avoids them from getting basic needs such as food. So what can we do to reduce the mitigation? What can we do to mitigate causes of climate change?
Yeah, so starting with some policy proposals and addressing crop losses. This year, we're having an updated farm bill going through Congress. So through updated farm bills, the federal government can increase the amount of money given to small and medium farms throughout the Midwest through agricultural insurance, which reimburses farmers for failed crop production. Insurance providers, with the support of the government, can also conduct risk assessments tailored to the specific needs and challenges faced by small and medium farmers. This assessment takes into account factors such as the types of crops grown, the local climate patterns, as well as historical yield data. However, focusing on the impacts of climate change without thinking of climate policy doesn't really make sense. Climate change policy is very complicated, but there are two policies that I'd like to highlight, starting with renewable energy investment. Given that 75% of emissions are from the energy sector, investing in renewables is the most effective place to start in combating climate change here in the United States. Thanks to the Inflation Reduction Act, the CHIPS and Science Act, and the Infrastructure Investments and Jobs Act, the US is set to spend over $500 billion combating climate change over the next decade. This is triple the spending versus 2009 and through 2009 and 2017, and 15 times higher than in the 1990s to the early 2000s. This investment is long overdue, but continued investment can help make up for lost time. It also has the added benefit of bringing a mix of manual and technical jobs to rural communities where they are needed most. Other policies can also include carbon pricing, which sets a price on emissions and creates incentives for the private sector to transition towards renewable energy. Next slide, please. I also wanted to highlight some recent research from the Environmental Defense Fund. It found that fields with covered crops and no-till management were 24% less likely than conventional fields to be declared prevent plant, which is when weather conditions prevent expected plantings, and that's when they receive an insurance payment. The research found that covered crops and no-till farmings were more frequently used on less productive farms that were more likely to have crop insurance claims. In effect, these practices reduce crop insurance claims despite disproportionately being used on riskier fields. In short, when sustainable agricultural practices are used, they reduce the impacts specifically here in flooding in the Midwest, saving farmers and taxpayers the costs of crop insurance, which is a great transition to our second topic, modern agricultural practices.
So one of the dominant traits of modern farming practices is monoculture farming. Monoculture farming refers to when only one type of crop is grown in a field for the duration of an agricultural season. So I don't know how many of you have ever driven west, but as you cross through states like Kansas or Illinois, for miles, all you will see is cornfield, and this is monoculture farming in action. This sort of crop dominance is not just exclusive to Kansas or Illinois, though. It can be seen throughout the entire region. Corn and soy alone take up 75% of Midwestern farmland. Many issues come from monoculture farming. The practice requires a significant amount of pesticides, which means that more pests and diseases are becoming resistant to pesticides due to overexposure in monoculture areas. Also, since monoculture is essentially mass production of crops, it puts heavy demand on the land, leading to soil degradation. So essentially, monoculture farming accelerates many of the problems that Ignacia introduced under climate change. Monoculture practices also carry
they also pose a health hazard for farming communities. Farms often produce pesticide drifts, which carry over into towns nearby, and several studies have shown that consistent airborne exposure to pesticides increases an individual's chance of developing respiratory pathologies like lung cancer or asthma. And heavy use of pesticides can also cause groundwater contamination, which threatens the clean water supply of communities living close to these farms. Additionally, since modern farming practices favor mass production, there's been a dieback of small family farms in the Midwest, meaning that many households have lost their source of income due to inability to compete with large-scale production practices. Since poverty is the #1 predictor of food insecurity, it's easy to connect the dots between how this loss of income can lead to hunger. Finally, monoculture practices have taken away communities' ability to depend on themselves for food supplies. It's a bit counterintuitive to think that despite being one of the largest agricultural producers in the world, Midwestern communities may face food insecurity. But in reality, as corn and soy continue to overtake regional supply chains, communities have to depend on imports for a fully nutritious diet.
Yeah, so some policies to address monocultures. The government can revise existing agricultural subsidy programs to discourage monoculture farming and promoting sustainable practices, shifting subsidies from commodity-specific support, such as previously mentioned corn and soybeans, to support more diversified and sustainable farming practices, such as crop rotation, integrated pest management, agroforestry, and cover crops can incentivize farmers to reduce their focus on single crop production while also taking care of the farmer's bottom line. The federal government can also enact laws that promote sustainable agriculture by setting stronger standards in organic farming, land management, and water conservation. The government can also regulate the use of pesticides and their use to mitigate environmental or health harm, as previously mentioned. This environmental stewardship will also help mitigate the impacts, as well as protecting farmers' livelihoods.
So next we will be looking at vulnerabilities derived from demographic shifts in the Midwest. Between 2020 and 2022, 400,000 people left the Midwest. In rural counties, the greatest population losses were found in communities whose primary industry is farming. So in short, Midwestern populations have an aging population, which is accelerated by working age people moving away in mass. This still limits opportunities for economic growth in the Midwest, as they are at higher risk of having more deaths than births. And it also leaves elder populations with strained caretaking resources. So essentially, it's not just working age farmers that are moving away, although there has been a huge decline in younger generations' interest in entering the agricultural industry, but it's also individuals that may be offering home healthcare services or operating grocery stores, pharmacies, etc., for these other populations that are being left behind in the Midwest.
So yeah, to address these demographic shifts, we can start by incentivizing young farmers. 14% or 5.9 million Americans live in rural poverty. As explained by my colleagues, a significant amount of the Americans leaving these rural communities are of working age. By incentivizing younger farmers through income tax credits or employment training, younger populations can return to these communities and help return a tax base to these local municipalities. Also, access to affordable housing is a really important issue in rural communities. According to the Harvard Joint Center for Housing Studies, 41% of rural renters are cost burdened. This means that at least 30% of a household's income goes towards rent, which cuts into family budgets for other necessities such as food or utilities. Put simply, you can't live where you can't afford it. By increasing affordable housing through expanding affordable housing tax credits for developments and Section 8 housing vouchers can help bring families back into the Midwest. Moving on to childcare and family support services, childcare access is extremely limited in rural communities. Research from the Century Foundation recently published information about rural childcare. Due to expiring pandemic benefits, beginning in September 30th of this year, states will face a steep drop-off in the federal childcare investment. I can even give an anecdote from my home state of Oklahoma. Without continued funding, 30,000 children within Oklahoma are expected to lose childcare. We're also looking at 45,000 kids in Kansas and almost 88,000 in Wisconsin. Continued investment into childcare and childcare facilities can help rural communities to make sure that they can have time to spend on work, to spend on taking care of their family and being more present in their community.
Virality reflects the lack of populace and proximity that facilitates residential and commercial use of highly developed land. Poverty in non-metro/rural areas persists at a higher rate than in the metropolitan areas. Rural areas are indicative of food deserts, where 45% of all counties in the US without any grocery stores are in the Midwest and Great Plains. Rural communities experience isolation and inaccessibility to social services such as SNAP and public transportation. Obtaining quality healthcare and education is deterred by geographic and administrative barriers, where utilizing the internet and information privilege is less likely to support the community.
So to address this reality, rural economic development and infrastructure grants. In 2021, the American Society of Civil Engineers gave U.S. infrastructure a C-. With smaller tax bases, infrastructure in rural communities often lags behind nationwide standards. Government investment in rural infrastructure such as roads, bridges, highways, and rail through infrastructure grants from the federal government will help create jobs in communities where they're needed the most, for the families to receive an income and for municipalities to receive a tax base. Other grants can also include nutrition-specific grants to, for example, bring in grocery stores to help promote local food production, moving down onto local food production. The USDA can expand the amounts of farmer markets where SNAP dollars are accepted. Fun fact, SNAP dollars used at farmers markets are actually doubled, meaning $1 turns into $2 for using it in farmer markets. By expanding the number of farmer markets eligible in these communities, this will help This can help families afford fresh, healthy produce, while also sourcing this produce from these local communities, helping alleviate some food insecurity.
Finally, health access. A study made by the USDA, specifically in the Midwest, found an impactful relationship between chronic diseases and food security. They surveyed 1,250 respondents from the Midwest, where in the sample there were 25% of the people were food insecure. They found out that 70% of the respondents that had diabetes were food insecure and were more likely to be medically uninsured. This did not only reduce the accessibility health access due to rarity, but there's also reduced health access due to lack of affordability. Finally, this creates a vicious cycle, since people that are food insecure have more chances of developing chronic disease, which make them have to decide whether they need to use their income for buying medication or to buy food. As they use most of their income to buy medication, this increases their food insecurity.
To help address these issues in rural healthcare, mobile health clinics have become a potential option to help address these gaps. For every dollar spent on mobile health, $12 are saved in healthcare expenses. For one mobile clinic, that turns out to 600 fewer emergency room visits each year, while at the same time, mobile health clinics operate at much lower costs, making funding easier. These findings were come through a 2020 research paper titled Mobile Health Clinics in the United States, published in the International Journal for Equity in Health by Malone et al. Moving on to telehealth expansion, as rural communities become increasingly connected to the internet, telehealth can become a major way to provide healthcare, especially for mental health. When the nearest clinic might be hours away, a video call for mental health services can help bridge that gap in providers. With that being said, mobile health clinics and telehealth are at the end of the day band-aid solutions. Even in communities with a sufficient population density that might warrant a permanent health center instead of a mobile clinic, a lack of insurance or expensive for-profit clinics might pose financial barriers to access healthcare. Federally qualified health centers are subsidized nonprofit providers, which help bring healthcare to low-income and minority communities. Increasing investment for these qualified health centers will help increase access to healthcare for these rural communities.
And with that, we will gladly take questions at this time.
Thank you. As a fellow Midwesterner, I feel like I just learned so much about, where I'm from. So thank you for that. We do only have time for one question. So from Gareth, we have a question saying, can you expand on what barriers exist for farmers and farming communities to move forward or move toward the sustainable agricultural practices you all discussed and how to overcome them?
Yeah,
I can take a stab at that. Or okay. One of the biggest barriers is obviously funding. There has been a lot of technology that's being developed to reduce pesticide usage and other environmentally harmful practices in monoculture farming. So they're using like laser tractors to subsidize for what would be pesticides, but that requires an extreme front end investment. And obviously, if you're a small scale farm, it's difficult to tie those funds together in time. Daniel, I don't know if you want to add on to that.
No, you're absolutely right. It's very expensive for farming communities. Farm patients.
Sorry, I was gonna touch on just also the historical practices of dryland farming and overgrazing. That has been a very recent practice in farming in the Midwest and the Great Plains, and the sustainability and reusage of soil is not probably where it should be to start with the sustainable practices without such funding.
Absolutely, yeah. Funding is really critical. The critical piece in all of this. It's giving given the subsidies for these staple crops like corn and soybeans makes it really hard for smaller farmers to compete with just huge monoculture crops. But through increasing funding to facilitate organic farming for these other types of sustainable agricultural practices, as mentioned earlier, that can really help make a difference in transitioning over towards a more diversified food supply.
Awesome. Thank you. I don't think we have time for another question, but you guys can go ahead and introduce the next group. Thanks.
Awesome. So first of all, thank you all for listening to us. We're excited to introduce our fellow interns who are Gareth and Fawad, and they will be speaking on cultural competency in the South in food.
Thank you.
Thank you, everyone.
Thank you.
Awesome. Thank you guys so much. Well, I'll start off with introducing myself. I'm Gareth. I'm a Master's in Public Policy student at the University of Virginia, and I'm placed with FHI 360's initiative focused on maternal and infant nutrition called Alive and Thrive. I'll back up a little bit and just give a background. We centered on the idea of cultural competency in food, and we're interviewing our supervisors and found that cultural competency is a very broad topic and one that we found was something that everyone had different definitions on. And so both Fawad and I realized that this is something that we wanted to drill down and really understand a specific facet of it. And so we focused on halal. And I will let Fawad introduce himself and kind of go into the background on why we chose this as our topic.
Hi, everyone. I'm Fawad Mohammadi, and to Zero Hunger, I'm placed with ACDI VOCA. So I go to school in Oberlin College. I'm actually an international student from Afghanistan. So as many students, international students know, it's so hard to be an international student. There are a lot of struggles. And one of the things is getting used to the food. So for me, it was not only getting used to a new food, but it was also finding halal food. So in many restaurants that I would go, I had to look at their menu or ask them if they had halal food. And if they didn't, I would just have a vegetarian. And then I would just have a vegetarian meal. The same thing with college. So when I was in college, there were sometimes our college only has chicken as a halal meat, and they don't have any other halal food. So what I would do, there were days that I remember, and my friends would see me, that I would just have a bit of fries, French fries, and a bit of fruit. Not a healthy meal, but I had to deal with it. So that's why when I talk with Gary, we were like, this is a good topic to focus on, to learn more about.
Absolutely. And I know from my perspective, it was the halal related food insecurity was something that kind of came to me out of the blue. I'm in charge of our campus pantries at the University of Virginia. And we had the Multicultural Student Center come to us and say, are you guys doing anything for Ramadan? And like, no, what would we do? And it was at that moment that I learned about all that Muslim students have to face as a result of the need for halal products. And so we've therefore, as a result, every Ramadan and throughout the year made sure that we have halal food available at all of our campus pantries. So I'll let Fawad talk a little bit more about halal.
Yeah. So now let's understand what does halal mean and how it is. So first, halal is an Arabic word or term. It means permissible and refers to the food that adhere to Islamic dietary laws. And these laws dictate that first, what kind of food can be consumed and how it should be prepared. And in our research, we find that there are 250,000 Muslim students in the States, and having halal food is not just a dietary preference for them, but also a religious obligation. And having halal food is so important for students. First, they can observe their faith through it. And we find out that like my experience was not just unique, that there are a lot of students who struggle with this, and a lot of campuses didn't have it. So first, a research done by an Institute of Social Policy and Understanding find that 32% of Muslim students at youth colleges say that their institution doesn't have any halal food, and that was a thing that was a finding that actually surprised me so much.
And in the same study, they found that 94% of all Muslim consumers say that it is important and vital that their purchase decisions be halal. And so it's not just a great thing to have for Muslim consumers and Muslim students, but a vital necessity, as Fawad was saying. But it's also a Southern challenge. We're focusing specifically on the South. 1 in 3 Muslims in the United States live in the Southern United States, particularly in Texas and Virginia.
Yeah. As Garrett mentioned, halal actually matters, because I have seen and I have friends who would love to halal food, and when they see that the chicken is not halal, and if they need to eat, then they have to just only have vegetarian options, or sometimes not have that too, and like me would just have fries. And this is unfortunately a growing challenge, as our findings show. As we find out that in 2014, Muslims would be the second largest religious population in the States, and as numbers of Muslims are growing, this challenge of not having halal food is also growing. And why does it matter to have a halal option in a college dining hall? First, it's a sign of respect. Colleges or institutes that have halal food, they're saying in a way, they're saying to their students that they respect cultural diversity, and they respect students who come from different religious background, and it also gives the students a sense that they belong to this college, that they feel that they're included. And having halal option is first integration of another diet, of a diverse diet. Halal is a diet, but also it would encourage students to have halal food too. If they need meat, they don't have to be vegetarian, not by choice, but because they have to be, because there's not halal option for them.
So how do we do it? So in our interviews with IFANCA, which is the Islamic Food and Nutrition Council of America, we found that there are 3 steps that they identified for integrating into any food service area, but particularly for dining halls. First is to inform and educate. Like I was informed and educated by our Multicultural Student Center that halal food is a necessity for many Muslim students. It's important to educate universities and their dining halls about the need for halal options. Second is to build the infrastructure to actually have halal food. First, working with dining hall staff and administration to source, deliver, and then actually prepare tasty halal food. And then finally, to maintain oversight. One of the most interesting things that we found was how many universities have initiatives to promote halal options, but how many of those fall away, or for a variety of reasons. If there's a really active student group that has promoted this and gotten halal options in their dining hall, and then those active students graduate, or if there is a certified vendor that they've been using that their certification has lapsed, or they're using different practices than traditional halal. it is really important to maintain that oversight to support the credibility and consistency of all on-campus halal food.
So how do food servers should prepare halal food? There are many ways, and then many Muslim communities would have their own, but these are the 5 general and basic things that needs to be in halal preparation. The first thing is like meat should be sourced from a halal animal, started with Islamic principle. This is so important. First, the animal should be alive before the slaughter. So when they slaughter, then the animal needs to be alive. And in a halal way, it gives the animal the least amount of pain. And when they are doing the slaughter, they need to say the name of Allah or God while they do it. And then the second thing is avoid using any like alcohol or any intoxicants in cooking, because technically alcohol is haram, so you cannot mix. Haram means not permissible, and you cannot mix halal with haram. And the third thing is like ensure that cooking area is free from any pork. So this is a strict Islamic law that no pork would be halal. So you cannot mix pork with halal food. And then the fourth thing is like avoid using any additives or food colorings that are derived from non-halal sources, such as gelatin. I have had like a lot of place I have been, they said the food is halal or this product is halal, but when you go and check their product, it has gelatin. So that technically makes it not halal. And then the last thing is use like halal certified products, such as Funko certified products, because when it's halal certified, and if you trust if you trust the people who are certifying it, then you don't need to look does it have pork or anything, because it's already certified. And another thing I want to mention is like halal is not the same as kosher. That's a huge misunderstanding that a lot of people have, and our research showed that there were some universities that they were saying the imam comes and bless the chicken after it's already slaughtered or any way that's not Islamic, and that shows that there's not that much understanding. So I want to make sure that a lot of people understand that halal is not the same as kosher. They have the similarities, but there are a lot of differences with them.
Well, and that misconception goes into exactly what dining halls say they do. And that's why it's really important to build that infrastructure and support good resources. And so in our interviews with UVA, or my interviews with UVA dining hall staff, we found that some of the biggest constraints are those building that infrastructure and that solid halal certified infrastructure. So when having halal certification, that means you have to have different storage spaces, different fridge and freezers, different equipment entirely. And that can be a big barrier for dining halls that don't necessarily want to add additional costs to preparing food. It's also meaning to educate staff, and implementing halal options requires, as Fawad just went through, a variety of different regulations and principles that can be difficult for staff that have been doing this for decades to understand. And especially in the South, where many of the advocacy organizations that focus on halal certification are based in the Northwest, are based in Chicago, based in the West Coast, and not based in the areas in the South that we've been focusing on. So it's also a matter of changing your suppliers and making sure to maintain the oversight of those suppliers and consistent certification thereof, changing up your menu so that different halal foods go well with other side dishes, and then finally maintain the feedback and satisfaction among the student population, to know what the student population really wants regarding certain halal foods and dietary preferences in general.
So before going to the proposed solutions, I want to say that definitely there are challenges, but like running an institution itself is a challenge. It's not easy to do many things, but it doesn't mean that it should stop us from doing these things. So we have 3 solutions, and I want to also say that different solutions work for different college campuses. And I also want to say that these are not the only solutions. Like, yes, we have these solutions, but these are not the only ones. First, our first solution is having a designated halal dining section, the same way as many colleges have. They have their burger section, they have their pizza section, they have their vegetarian section. Having such section. having this designated section. This first encourages interaction between Muslim and non-Muslims, so it doesn't segregate them. They can all come to one dining hall, and also having this halal section can mean that there's diverse diverse diets, and a student can non-Muslim students can also have can also try halal food. And also this is when they have this section, halal section, this would also mean that this is immediate access, like students don't have to go off campus to get their halal food. But there are cons with it. First, it's risk of contamination of halal and non-halal food, as we were mentioning, that the kitchen should be free of pork, and also the utensils, like have they cooked a non-halal food with that utensil or not. And another thing is also another con is maybe non-Muslim students would go and eat in that section, and then they would not have enough halal food for students who actually observe halal.
So the University of Chicago has implemented these designated halal sections within 2 existing dining commons. This has meant that, as Fawad was saying, students can eat halal and non-halal food together, which has pros in terms of students being together, but definitely cons in terms of potential contamination. But it has allowed the dining commons to include a wide variety of, wherever there are individuals who eat halal food, there are amazing different culinary options. There's not just one option. So everything from Southeast Asian, Middle Eastern, North African, and American halal foods that have been able to present to UChicago students.
And then our second solution is having a standalone halal dining hall, which means that it's separate from other dining hall. This first means that there would not be cross contamination. This will eliminate that, and also it provides a sense of community that all the students can come, all Muslim students and non-Muslims can also come and have that community, because Muslims, it's yes. It refers to us or to them as Muslims, but it's different groups from different backgrounds and different in different culture. But definitely, it has also cons. As we don't have that much time, we're gonna only mention a few of them. First, it can give the feeling of segregation, that halal food or Muslim students are away, and maybe non-Muslim students wouldn't feel comfortable to go to eat in those dining halls.
And they have overcome some universities have overcome these limitations. The University of California, San Diego is one of only 2 campuses in the country to achieve full halal certification, and has a variety of different dining preferences that are included. Everything from Korean barbecue to tofu banh mi burgers, but everything within the dining hall is halal.
And our last solution is having certification, halal certification for all dining hall. This means that this would make it easy for dining hall, so they don't have to get their food from 2 different companies. They can all get it from one. But it also has cons. It can make some dietary restriction, for example, kosher, not be available in some of the spaces.
And we'll just end with saying that it's just the beginning to have halal options and halal certification. It's important to have various quality and various different foods and amazing quality, to have it diverse, nutritious, and delicious. Make sure that it's clearly labeled, especially in cases like the University of Chicago, where you have specific dining hall sections. Make sure that students that eat halal know it's halal. And then amplify for other dietary awarenesses. If gluten-free, dairy-free, once halal is established, other different dietary preferences can be included then as well. And celebrate different cultures. Halal is a very wide variety of different cultures that all go into it. And then finally, it's important to educate other universities. Many best practices relating to halal come from Muslim student associations and other student groups advocating to other groups across the country. So with that, I'll let Fawad have our last word, and we'll move on to questions.
Yeah, I want to say one more last thing. It's not about only colleges. It's not about if I'm a student advocate that this is relevant to me. It's relevant to anyone. If you have a Muslim friend, or if you have many Muslim friends, please, like, when you have a gathering, have it in a place that either has halal food, or either it has at least vegetarian food. There has been a lot of places that I have went with friends just to be with them, and then that place doesn't have halal food, and sometimes there's not that much vegetarian option too. So with that, we're gonna go to questions.
Awesome. Thank you so much for that, guys. I have a question for you. So you talked about how the University of Chicago has, made a fully cited place for halal. So I'm wondering, how can more people become aware of this issue, and other colleges become more aware of these issues with lack of halal?
Right. Yes. So U Chicago has a designated section, and then the University of California, San Diego has their own dining hall specifically for it. And I think going to the last point, I think it's just about talking to each other. And a lot of one of the things that we found is best practices come from individual student organizations, specifically Muslim student organizations, advocating to their administration so they're aware, but then talking amongst each other. A lot of organizations are chapters of national brands, and so if you're part of a food organization that, like Food Recovery Network, I know we've talked about, talk to your HQ, talk to the higher ups that reach all universities, and mention that we need to have halal options at all universities as a mandate and an advocacy. Fawad, anything to add?
Yeah, I just want to add that yes, having first, again, talking with each other. Do not assume that this is halal. And I wanted to go back, as you said, many students are doing this. So it hurts me that it's only students who are doing this thing. Like, it's my job to study, but also I have to fight for the food that I need to have. I know I have to do it, but like, how long? And it's not recent. Like, Muslim students have been in the States for a long time. Muslims have been in the States for a long time, but still the fight is, unfortunately, alone students are doing it alone. And I have seen it in my campus and a lot of campuses, that students are the ones who are doing that. And sometimes it's a lot. It's a lot of work for students. And other thing, college can also work with organization that we talk, FANCA. They know better, because again, there's sometimes a lot of time it's just assumption that, okay, it's similar to this, we're gonna just get this food and then just bless it, which would not work.
And I'll just add on to that AFANCA and many different organizations that support halal certification have worked on specific dining culinary courses. The University of Texas has received a grant to have a halal culinary course. And so a lot of Southern universities in particular have been really reaching out and making sure to not only include this within the dining halls, but also in the course curriculum as well. So it's not just being able to eat great food, but also learn about it in the classroom.
Awesome. Thank you. It looks like we do have time for one more question. So as your internship comes to an end, is there anything that you wish you would have had more time to research in regards to this topic?
So I'll say from my end, I think one of the things that we started very, very broad with, as I mentioned, the idea of cultural competency. And we're starting with kind of the idea of, we want to understand a little bit more about food pantries and food service in general, and then narrow down to our core competency in terms of understanding college campuses. But I think I'd love to learn more about what food pantries are doing, and what other spaces for those experiencing food insecurity are doing to make sure that that individuals, whether it's halal, kosher, gluten-free, allergen-friendly, any of those types of things where we have certain dietary preferences that need to be established, what spaces for folks that are experiencing food insecurity but also have dietary preferences need to understand.
Yeah, on the same point, unfortunately, the few organizations we have talked with, they don't know that much about it, and that surprised me. Like, organization who work for anti-hunger, they don't know that much about it. So I wish that we had enough time to talk with them and to see, like, as Garrett mentioned, if there are food pantries or any organization who is working on this area, to see what they have done for this work.
Awesome.
And yeah, and thank you so much everyone for listening. Thank you for all the great questions. And now we're gonna hear from the amazing group, the West Coast group.
Hi everyone, today we're going to be presenting on early childhood malnutrition in Rwanda. So my name is Lauren White and I'm currently placed with the United States Department of Agriculture. I recently graduated from the University of Arizona in May and am from Phoenix, Arizona.
Hi everyone, my name is Erin Katahira. I'm originally from Honolulu, Hawaii, but I'm completing my undergraduate degree here at the George Washington University in DC. And this summer I was placed with the Congressional Hunger Center.
And hi everyone, I'm Sabine Umuhire. I am originally from Rwanda, but I go to school at Case Western Reserve University in Cleveland, Ohio. And this summer I was placed with CARE.
So today we are focusing on policy-driven solutions, and to frame our conversation today, we would like to introduce a quote from one of our interviewees, Elvine. The section reads, "I am an expert on nutrition, not an expert on people's culture." Elvine worked specifically in childhood malnutrition in Rwanda and is currently continuing her studies as a PhD candidate in community nutrition. So the main goal of our conversation today is to strengthen efforts already in place and work to build resiliency for the work already being done by including local communities in the conversation to end childhood malnutrition. As a roadmap for our conversation today, we will focus on hitting 4 major topics. First, we will start by providing some background information on the country of Rwanda, then providing context on childhood malnutrition. We will then discuss current efforts in Rwanda and finally our policy suggestions. So Rwanda is a small landlocked country in East Central Africa, hosting about 13 million citizens. Most people know Rwanda through the 1994 Rwandan genocide. Rwanda relies heavily on agriculture to drive its economy, with the main exports being coffee and tea. The main challenges faced in this country surrounding the quality of the built infrastructure, for example, water and electricity access. Additionally, there are increased barriers to essential basic services such as education, health services, and social safety nets. The problem of early childhood malnutrition can best be described by the triple burden of malnutrition, including overnutrition when a child's weight is too high for their height, hidden hunger when children do not get essential vitamins and minerals, and undernutrition when children do not eat or absorb enough nutrients to grow. This can lead to stunting or low height for age. For the purpose of our conversation today, we will be focusing on undernutrition.
So, close to 800,000 children under the age of 5 currently experience stunted growth in Rwanda, which is equivalent to about 1/3 of children. Rwanda has made massive strides in the fight against malnutrition, as the rate of stunting was just over 52% in 2005, or 17 years ago, but there's still a lot of work to be done. And this quote below, which is publicly available and from the current president of Rwanda, states that stunting and malnutrition have consequences beyond the child who is affected. When it affects many children, the whole country suffers. When our children are stunted, our nation is stunted. And this demonstrates that stunting is not just a short-term effect. Because stunting can create both long-term mental and physical deficits, this will continue to impact a child's ability to succeed in education and in the future to be contributing members of the workforce. And this really impacts the prosperity of Rwanda as a whole. So there are 2 main barriers to addressing early childhood malnutrition in Rwanda. The first is low agricultural productivity. So currently, 33% of Rwandan GDP comes from agriculture, and because Rwanda's agricultural land mainly lies on sloped hills, each year Rwanda loses about 1.4 million tons of soil due to land degradation and soil erosion. Additionally, due to inefficient farming practices and the low adoption of fertilizers, Rwandans also struggle to cultivate land that is available. This creates difficulty in generating wealth, which leads to increased rates of poverty and food insecurity in the country. Additionally, there's also inadequate medical access or barriers to accessing medical care. Although most Rwandans have health insurance that's available to them, because Rwanda is a predominantly rural country, ensuring that medical care for women and children is accessible is definitely a challenge. According to the World Health Organization, the average time it takes to walk to a clinic in Rwanda is 47 minutes. And not only does this impact the health of children in the early stages of life, but also the health of the mother during their gestational period.
So, what is being done in the country to address the issue of childhood malnutrition? What are some efforts that have shown some level of success? First, we have government-funded social protection programs, such as homegrown solutions like the Zero program, which have made positive impacts among pregnant women and children. Diringa roughly translates to "May you have a cow," and under this social protection program, vulnerable populations who would benefit from owning a cow are identified, and they're given a pregnant dairy cow. They benefit from the cow's milk production and manure, and then the beneficiaries are obliged to give the firstborn female calf to other worthy beneficiaries in their community. So in Rwanda, in the Rwandan culture, a cow is a sign of partnership, collaboration, and togetherness. But it also produces milk, which is a source of nutrition for the family, as well as income with the sale of surplus milk. It will generate organic manure, which they can use to fertilize and rehabilitate depleted soil. Since its start, the program has provided over 300,000 cows to families in need. It has contributed to doubling milk production, helping reduce malnutrition, as well as improving household income. I have an aunt who lost everything during the 1994 genocide, and she had to start over. She was a beneficiary to this program, and we interviewed her, and she attests to how indispensable this program was to alleviating food insecurity in her household during those early stages when she had to build everything back up from the ground. So other protection programs include Mutuelle de Santé, which is a community-based insurance scheme that is run by the government of Rwanda, and it makes healthcare very affordable. Every time I'd gone to the hospital here in the US and looked at the hospital bill, I always joke with my friends and say, if I'd flown back home for a round trip and then got treated, it still would have been cheaper to do that instead of paying the hospital bill here, because that is how affordable healthcare can be in Rwanda. So Rwanda has also invested in its health systems. It has improved access to primary health care and deployed tens of thousands of community health workers to the front lines. These efforts have led to significant progress for the health of women and children. So, for example, between 2000 and 2014, maternal mortality decreased by 80%, and infant mortality declined by more than 50% since 2010. Another area is nutrition mainstreaming, which the government of Rwanda defines as embracing nutrition aspects in planning and implementation of its support for agriculture production. So there are existing programs such as the crop intensification program, production of protein-rich crops and animal source proteins, which have been launched to target stunting. There's also research for development of biofortification that is being strengthened, all to supplement children's diets. For instance, Rwanda was among the first countries to grow iron biofortified beans, as beans are a staple in Rwandan households and make up to 60%, 64% of protein intake for the average household. So I hope you can see that all these efforts reflect local context and values, which is why they have been effective to an extent. One of the projects that I was involved in highlighted the disconnect that can occur when international aid does not embrace local contexts. My colleagues and I pioneered a project to produce fortified passion fruit juice to distribute among homeless children in my hometown. And one form of international aid that was being provided to them was through milk and milk formula, which was unfortunately making them sick, as we would often find them on the streets trying to sell the aid that was being provided to them. So most of these children had spent the majority of their lives on the streets and had probably not been introduced to milk early enough to avoid developing milk allergies, which is a very common allergen. So although Milk Aid was indeed a very good initiative, as milk is not very affordable in Rwanda and can be quite expensive, the project did not consider these children's local contexts. So this is why our recommended policy-driven solutions, which we will be talking about next, aim to support programs that are already in place and center the local community's context in the conversation.
So, as Sabine just mentioned, our first policy suggestion would be to strengthen the current agricultural policy. So, the plan for the transformation of agriculture, which is abbreviated to PSTA4, supports Rwanda's national agricultural policy. The main goals of this policy are to improve input quality by catering to cultural food preferences and needs, improve production practices, and improve post-harvesting handling and storage and processing methods. By focusing on diversifying higher value agricultural products, especially those coming from the private sector, household resiliency to production risks increases. This generates off-farm income, which is crucial as much of Rwanda's agricultural output comes from smaller family-owned farms.
So another solution is encouraging women-led cooperatives in rural areas of Rwanda. So women are engaged in agriculture as well as other allied activities, which contributes to the biggest percentage of Rwanda's GDP. But because of the patriarchal nature of Rwandan communities, women, especially in rural areas of Rwanda, are often deprived of land rights, and legal land ownership will often be under the man's name. So because of this, financial institutions may not focus on female farm workers when it comes to providing institutional help and financial aid. So one actionable area is promoting women-led cooperatives. These organizations can offer capital assistance, guidance, and institutional aid, which would equip women across rural Rwanda with the necessary skills to access microfinancing opportunities as well as invest in new projects. These organizations can also educate women about skills related to financial literacy, such as how to secure flexible loan conditions. They can also train their members in agribusiness and enable them to fight for their land rights and engage in economically viable agricultural activities, which they can use to then market their crops. These opportunities would then generate income opportunities for these women, which can reduce poverty rates and combat food insecurities in these women's households.
All right, and so for our final policy solution, we recommend implementing funding for mobile health clinics. So like I mentioned earlier, although health insurance is widely accessible in Rwanda, the average that would be fully stocked with the medical equipment needed to perform medical care. They would also be staffed with medical professionals with the capacity to provide prenatal care for mothers during pregnancy, as well as for their children in their first few years of life. And this could be essential in providing healthcare services such as nutrition assessments, growth monitoring, immunizations, counseling on breastfeeding and complementary feeding, and even treatment for infections and other diseases. Mobile health clinics could help ensure that even the most remote and rural communities in Rwanda have access to vital nutrition support. And these services would be essential in fighting childhood malnutrition by expanding access to medical care for women and children across the country. So finally, we just have a few key takeaways that we want to share with you all. As a reminder, undernutrition is a serious problem in Rwanda, and almost 1/3 of children currently experience stunting under the age of 5. Our policy recommendations include strengthening agricultural resiliency and creating self-sufficiency in Rwanda, as well as women-led cooperatives to facilitate economic empowerment for women across the country, and funding for mobile health clinics in order to remove barriers to health access for rural Rwandans. And we also want to leave you all with the quote that we shared at the beginning as a reminder that when working with international communities, it is crucial to remember that we are not experts on others' cultures. We aim to propose policies that emphasize self-sufficiency, and we're guided by those with lived experiences in Rwanda. And we hope that you all continue to do the same as you work with communities outside of your own. Thank you. And on this final slide, you'll find our contact information. Please feel free to reach out with any further questions or to connect with any of us.
Awesome. Thank you so much. So Sabine, I have a question for you specifically. I'm wondering if you can talk a little bit more about the passion fruit project that you worked on.
Absolutely. During the pandemic, when I was in Rwanda and I had a bit of time on my hand, before that, I was heavily engaged with community projects, especially around my community, which is very small and very intertwined and tight-knit. And so we're very aware of all the issues that are going on in the community. So I was aware that there was an international project that was distributing aid to specifically homeless children in my community, but I wasn't sure who was in charge of that. I did notice, however, me and my colleagues, that these kids were not actually consuming the aid that was being provided to them. Most of them were in the streets trying to sell them for money. And then when me and my colleagues noticed that, we started approaching them and asking them why they were actually selling the aid. And most of them would mention that it was making them sick. So we were thinking, and we came to the conclusion that, well, we didn't come to the conclusion, but logically, because these children are malnourished, they've been in the streets for the majority of their lives. In milk, we know already that even the average household does not get to consume milk daily. So we were thinking that maybe these children have not been exposed to milk, which is why they were which is why the aid was making them sick, basically. So we just tried to fortify passion fruit juice, because that's one thing we know that is widely consumed in the country of Rwanda, and to replace some of the nutrients that were missing in normal passion fruit juice that were present in milk, and then have them present in passion fruit juice, so we can distribute the aid and have these kids also access the nutrition that they were missing, that the other kids were consuming.
Yeah, thank you for sharing that, Sabine. I do have one final question for you all. So can you talk about any challenges that you may have ran into whenever you were doing your research?
One issue that we did come across was the fact that Rwanda is a very small country, and most of the sources that we were trying to find online are not very widely available and are not actually accurate. And so we did have a bit of trouble finding information to back up our claims. That's why we did rely on personal interviews and firsthand knowledge experience, like example for me, because I've lived there for the majority of my life. And so, that is one issue that I could say we did run into.
And then just to hop off of Sabine's comment, we actually originally focused our research on the country of Yemen because we know that there is high rates of malnutrition across all age ranges in that location. But throughout time and preliminary research, we found the importance of having a connection to the place, and especially since there is that geographical, like the physical separation between where we are in DC and the country itself, we wanted to prioritize implementing community and local initiatives. So with Sabine being from Rwanda, we thought it was really important to integrate something that, like we felt was more accurate of the community that is there.
Lauren, do you want to expand, or we do have another question in the chat?
No, I think that covers it.
All right, awesome. So we do have a question from Laura Tarr asking, expanding upon the quote about being an expert on nutrition and not others' cultures, is this why you chose to build on Rwanda's existing efforts to combat malnutrition rather than come up with new policy solutions?
Yeah, go ahead, Lauren.
Okay. Yeah, I would say absolutely. We definitely tried to focus on looking at what was already done in the country. We wanted to make sure to really highlight that instead of coming in from a perspective of bringing in aid and, like Sabine said with her story about individuals that brought in milk into the community that wasn't able to properly process it and drink it due to milk allergies. We wanted to ensure that we were keeping those types of stories in mind and really building on what the country is already doing, because as I shared earlier, they have already done amazing efforts to reduce childhood malnutrition in their country over the past couple decades. So it's important to build upon those existing efforts and provide support where we can.
Yeah, we also have the experience of organizations, international organizations coming into countries and starting up these projects. But when they go away, like we've seen in the summer seminars that we've had, the progress that they came with also goes away because they did not focus on building resiliency to the programs that are already there. So that's why we focused on the programs that were already in place.
Awesome. Thank you, guys. So this does conclude our summer seminar series at the Congressional Hunger Center. Before we let everybody go, I just want to mention that the Hunger Center will be conducting some activities in September for Action Hunger Month. And then in October, we do have a Zero Hunger Challenge. That would be amazing if you all would join. You can join that by joining our mailing list at the Congressional Hunger Center's website to stay informed. Once again, thank you all for joining and have a great rest of your day.